What is the legal definition of competence? Well, it's actually pretty simple and straightforward. It's knowledge, skills, and ability. So let's unpack that for just a minute. We know that competence, as it relates to a clinical role like nursing, that nursing is a practice discipline. We don't become competent just because we sit through a lecture, read an article, complete what is that? Complete a module or do some didactic learning, right? We don't become clinically competent. We actually acquire meaningful information like anatomy and physiology, like pharmacology, like our patient's past medical history, like the vital signs and their current condition, and the knowledge of the resources that we have around us. I mean, all of those bodies of knowledge are cognitively acquired, and that's what we're working from. We also, when it comes to a competency that's a skill-based competency, we need to know how to execute that skill. We need to actually have the right technical know-how, the psychomotor know-how of actually performing the skill. And so, how do we know when and where to do that skill? Well, we're matching that with what we know of the situation. And so that's the ability piece here, right? So knowledge, skills, and abilities, that's the definition of competence. This comes with application. This is why you don't go to nursing school and just sit in a class and then take an NCLEX and get a license. We have to have clinical rotations. We have to take our knowledge and put it into practice. And we acquire what we call experiential knowledge, practical knowledge. And so all of that helps put together not only our cognitive knowledge, but our skills and our know-how to do the skill. So I have to draw on the right knowledge, and I have to execute the skill technically, and I have to do both of those in real time that's appropriate to my patient's condition and that context of care, and that's where the ability piece comes in. And so once you achieve all three of those, then you are legally deemed competent.